Okay, good evening. This is Brother Wolf, and this is HS 285, Section 3. And tonight we are going to hear from Group 2. Their topic is osteopathic medicine, and I will just turn the time over to them. And I believe Vanessa's starting first, so whenever you're ready, Vanessa, feel free to start.
Thank you, Brother Wolf. Well, thank you everyone for coming in tonight, and thank you for my group also. I think we did a pretty good coordination on, to get this presentation for the entire class. So we are just going to talk about what osteopathic medicine is, and basically. Osteopathic medicine is a philosophy. It's also a medical degree, but it's also a philosophy where the diagnosis or the treatments they're actually holistic. It's a word that I heard a lot and read a lot. It's a holistic approach to medicine where the wellness is focused on your mental, spiritual, physical. All these groups combined. That's what they consider, health. Basically, according to the American Association of Colleges of Osteopathic Medicine provides all of the benefits of modern medicine, including prescription drugs, surgery, and the use of technology to diagnose disease and evaluate injury. It also offers the added benefit of hands-on diagnosis and treatment through a system of therapy known as osteopathic manipulative medicine. Osteopathic medicine emphasizes helping each person achieve a high level of wellness by focusing on health promotion and disease prevention. So it's more than just attacking a disease or illness or fighting a disease, but it's also preventing diseases and illnesses, and also maintaining an overall health. Also on the next slide, thank you. We have 30 osteopathic medical schools, which are offered throughout 40 locations, and that's based on the academic year of 2014 and 2015. So there's a map there. And then I believe that's Krista's.
Yes, Krista's. So the question that I had to answer was, when and where was the first osteopathic medical program launched? And the first one was launched in Kirksville. I believe that's Missouri. Not sure what the abbreviation is. But the frontier behind the whole osteopathic, idea or approach was Andrew Taylor Still. So he kind of founded this school, and we're going to learn a little bit more about him in the next couple of slides. But he believed that the system that they had at the time lacked efficacy, and it was kind of corrupt, and it treated the effects rather than the causes of disease. So at this time, there was medication, surgery, and other regimens that often caused more harm than good. They used unsanitary surgical practices that often led to death. And he actually lost 3 of his children, and I think that was a big reason why he wanted to look for a better approach. At the beginning, osteopathic medicine had a rough start, so the American Medical Association labeled it as a cult. And it wasn't until 1962, which is a long time past 1892, that they approved a measure allowing qualified osteopathic physicians to serve as full active members of the association. So you might wonder, you probably heard the term MD for normal doctors. So you'll probably wonder why there is a second medical degree. This one is called the DO, and this is what we call any doctors who have been through osteopathic schools. Allopathic medical schools are what you would typically call for MDs. And they basically teach about the same science curriculum, but they have different approaches, just like Vanessa was explaining about the holistic approach. And according to the American Osteopathic Association is kind of saying the same thing, that they regard the body as an integrated whole instead of treating for specific symptoms. And the DOs place a specific emphasis on primary care. So this is just a little bit more about Andrew Taylor Still. He was one of the principal figures, if not the most principal figure in the development of this type of medicine. He was born in Virginia, the son of a Methodist, and he served in the Civil War. And following the Civil War, he 3 of his children died from spinal meningitis, and that kind of like gave him that motivation or that reason to look for a better type of approach. So he devoted the next 10 years of his life to studying the human body and finding better ways to treat the disease. He believed that by correcting problems in the body's structure through the use of manual techniques, which are now known as osteopathic manipulative medicine, that the body's ability to function and to heal itself could be greatly improved. And I think we're going to pass it over now to Valen.
I think she is trying to get back on.
Okay.
Some issues.
Why don't we just let's try to give her some more time. If it doesn't disrupt your presentation too much, do you want to progress to slides beyond hers, and if she gets back in, we can come back to these?
Not a problem. I'll just go and maybe go to exactly slide 8 right there. So how does osteopathic training, slide 8, Krista?
One more.
Yeah, I'll just take over from slide 8. So
okay.
How does osteopathic training differ from traditional medical school training? So the one key concept that the students learn is that the structure influences function. So if it's the overall body, actually I'm getting ahead of myself. So anyway, so if there is a problem in one part of the body structure or a function in that area and possibly other areas, then all of those, not just that one area may be affected, but it could be, the whole other areas that could be also be affected. So students learn the basic principles of osteopathic manipulation and how it can be applied to their practice of medicine to augment or to enhance the traditional medical care given to their patients. So basically the DOs and the MDs, they have the exact same scope of practice and the exact same opportunities to specialize and practice their profession and their skills. So for the patient, many times, more often than not, does not see the difference. The only difference really is that if the DO chooses to use his extra training in using some of the manipulation techniques, so it's actually, that's when the patient would actually see that there's a little more to their treatment or to the care they're receiving. So on the next slide, we have some pictures of some of those manipulations, and I found it very interesting that there's all age groups can be benefited. So the baby right there, I thought that was pretty cute. So on the next slide, there's actually a minute video that I'm not sure that we'll be able to play it, but hopefully. But it's just a minute long video that shows a cervical thoracic junction manipulation. See if it will play.
Yeah, it just looks like it's loading, but I'm not sure it wants to play.
But it's very interesting how, it looks almost like a chiropractor. And from what I was reading, there are some, similar techniques used and some principles used in the other types of, like chiropractors. So I don't know if it's going to play or not. But
yeah, it doesn't look like it.
Okay. But anyways, but it's
Oh,
on the
yeah, and
file I added.
that's okay. I was just going to say, I'm sure there's a link, when the slides are posted, students
Yeah.
can view it there
Hmm.
as well. Because
Yeah,
that would be
it's kind of
interesting.
interesting to see it, how that is, how that technique is applied and
Yep.
to the patients. But so anyway, so on the slide 11. Um, Oh, for Chris. Okay. So a lot of there's a question whether there's some competition between MDs and osteopaths. And yes, I've seen some of the people that I've talked to. They said that there is a healthy amount of competition, and I think that's true with whenever there's human beings involved. I think there will always be some sort of maybe competition or feelings of superiority or not. Because we have to understand that the MDs are the traditional physician that Americans and most people in the world are used to. So anything that's a little different or strays a little far away, then there might be some, some struggles here and there. But overall, from what the feedback that I got from actual MDs and DOs, is that it's a very respectful, and there's courtesy and mutual cooperation between the two ideologies. So they work very well together. Just they are respected, and in their profession, in their skills. So then on the next slide. This is my brother-in-law. His name is Jacob Nelson, and this is a picture of him with my OBGYN, and this is me with my youngest baby, just last September, and he's a third-year medical student, and he is studying to be an osteopathic doctor of osteopathy. So he helped deliver my baby, and he's a great guy, very intelligent. So these are the questions I asked him on the next slide. So I asked him, why did you choose to become an osteopath rather than an MD? And he said, I chose to be a DO because I like the idea of approaching my patients from the perspective that their health is composite of their body, mind, and spirit. I found this very interesting. So he goes on to say that this is a big thing within osteopathy, and they look at the patient and realize and appreciate that the disease and pain come from any one of these things being out of balance. Additionally, I had some great experiences with DOs. In parentheses, that's my my OBGYN is the DO that he was rotating under, and he's a great doctor. Anyways. So moving along, he just said that he liked the way DOs approach their patients, and he feels like it's a better way than the traditional physician. The DO mentality and approach to patients in medicine matched his personality, and closer than the MD approach. And he said that, to be completely honest, I was a more competitive applicant at DO schools, and he was accepted, readily at his DO program. So then the next question is, and I'm sorry, I'm a little nervous. But basically, the last question was, do you feel that there are important differences, and what are those differences? His response is that in the everyday practice of medicine, the differences between MDs and DOs are insignificant. Most patients wouldn't know or care that they were seeing a DO as opposed to an MD, because the treatment they receive is pretty much identical. For me personally, I feel that the DO mentality is an important difference, because the idea that the mind and spirit contribute to the overall health of the patient, and that resonates with me. I feel that the principles of treating and communicating patients embraced by osteopaths more closely align with my personality and how I want to practice medicine. So medicine isn't about a cold, sterile facts all the time, and sometimes MDs, he says, sometimes MDs have that mentality. So anyways, and in some, he felt like the DO philosophy of treating body, mind, and spirit resonated more with his personality and his approach, or what he would expect to, his approach to medicine and treating people, treating human beings. So basically, that's what he had to say about that. Here's our references, and I don't think that Valen is. Oh, she's here, I think.
Hi, Valen. We noticed that you had to drop out. So we kind of proceeded past your slides, and I don't know, Krista, if you can go back so we can let Valen share what she wanted to share.
Yes.
Yeah, I'm really sorry. I've never had these computer problems before, but yeah, that'd be great.
Yeah, no, it's no problem at all.
Okay.
I think it was just this one, right?
Oh, whoops. It looks like your screen share stopped, Krista.
Uh-oh.
I think it was basically slide 7 and 8 for you, Valen.
Okay. There we go.
Yes, there we go.
Okay, so I was able to do a little research on Abraham Flexner, and he basically was considered, his report was basically considered one of the most important events in medical education. In 1910, he published a book-length study kind of on the condition and the situation of medical education that was happening in the United States and Canada. He wasn't exactly proud of or happy of the standard of care, and he kind of took action into his own hands and said, hey, you know, I'm going to write a report and we need to make some changes. After he wrote this report, that triggered a huge need for change in the medical, health, and education industry. He basically kind of highlighted on things such as higher admission and graduation standards, following protocols. They needed to incorporate more teaching and research and more hands-on training. Basically the fact that schools needed to educate their physicians to a higher standard. They needed to step up to the plate, and basically that schools were kind of operating more for profit than for education at the time. So many medical schools actually closed down as after this report was published because they weren't up to par, and the rest of them reformed to the standards that Flexner wrote in his report. So he totally transformed medical education in America, and he's very well known in physician and medical education history. So, next one. Okay, then our next question is, how does osteopathic training differ from traditional medical school training? Kind of in the research, they actually are quite similar. One difference between the two is that in osteopathic medicine, the students learn that structure influences function. So basically, they kind of talk more about the principles of manipulation, how it can be applied to their practice of medicine. And DOs have actually the same scope of practice and the opportunities that MDs have. So to the patient, it really doesn't matter if you see an MD or a DO, you're still seeing a physician. Basically, the only difference between DOs is that they have that extra training and manipulation, which they can then bring to the table and offer to their patients with care. So not huge differences between the two, but there still is that big manipulation factor difference with the osteopathic training.
And I think we may have talked about every single slide. I believe that's the end of our presentation.
Excellent. Very well done. You guys did a super job. Let me just ask you a few questions that it's okay if you don't know them. I'm just curious if you came across the answers to these as you were reading a little bit. On Abraham Flexner, anything about his background? Was he an MD or a DO? I mean, what kind of
I didn't find anything about that. Did either of you?
Yeah, he actually was not a physician. He was actually a teacher, and then he went to go do research at a.
Yep, that's exactly right. So it's interesting that his report had such an influence because he's an educator. So he's not an MD, he was not a DO.
Graduate school, and he actually was not a physician.
You're exactly right. He was an expert in education, right? And so his report really focused on medical education, and not so much on the medicine part, but on best practices in education. And so it was a very influential report as far as medical education goes. So that's a little interesting tidbit.
Probably why he made such a revolution, maybe, because it was the outsider looking at how can we improve this. Sometimes you do need that perspective, the outside perspective of that industry.
That's an excellent point of having somebody who's an expert in education, regardless of whether it's physics or poetry or whatever you're studying, whatever the subject matter is kind of irrelevant. He was an expert in, okay, what's the best way to help people learn certain things. And so I think you're right. I think that kind of external perspective can be very, very helpful, and it was very influential. And most medical schools are still following kind of the basic paradigm, at least, of what he outlined. So that's interesting. The other thing, you guys really hit all the main points, and I just want to reiterate that what you stated is true and accurate, that there's really not a big difference between MDs and DOs, at least today. Now maybe 50, 70, 60 years ago, there may have been at least a perceived difference. It might not have been true, but really today, the training is more or less the same. It's still 4-year curriculum. There's basic science, and then there's rotations. So typically, medical school, the first 2 years in general are a lot of lectures and laboratory work. So you're mostly in class all day, learning biochemistry and anatomy and pathology and these different scientific topics, and you do that pretty hardcore for about 2 years. And there may be some introduction to clinical exposure, like in a clinic or in a hospital, but it's limited, if at all. It's really those 3rd and 4th years that you start doing required rotations, such as 12 weeks in surgery, 8 weeks in OBGYN, 8 weeks in medicine, 8 weeks in psychiatry. So every medical student will go through these required rotations so they get exposure to all of those things. And more or less, DO and MD, they basically do all those same things. I think it's true historically that DOs kind of have this, at least historical perspective on treating the whole body. And I think that's probably true. There's a lot of focus on that. But that's not to say that MDs don't also get that. So I really see a lot of the differences starting to kind of fade away. And neither school philosophy has a some sort of monopoly or patent on these ideas, right? You'll find some MDs who really believe in the philosophy of treating the whole person, and you'll find some DOs who want to be very specialized and become, a neurosurgeon, and they don't want to do primary care. So it's not a mandatory rule, but these are generalizations, and you always have to be careful about generalizations. So you might meet a DO that doesn't really fit what we're talking about here, and that's okay. Both students end up doing the same types of residencies generally, but in general, osteopathic schools do focus a little bit more on primary care, so they probably have a higher percentage of graduates going into family practice or internal medicine or OBGYN or general kind of primary care specialties. But that's not to say that you won't find DOs who are cardiologists or surgeons, because you will. And likewise, MDs might focus a little bit more on these specialties, but that doesn't mean that you won't find certain medical schools that really focus on primary care. So I think you guys hit it on the head that there's really not a whole lot of difference. There is that philosophical difference that I think is becoming more and more historical, in that treating the whole body, and that this concept of structure affects function. So osteopathic, bone manipulation can have some sort of effect on the whole body, and they are trained in these osteopathic manipulations. But a lot of DOs I've met just don't do that in their day-to-day practice, so they quickly lose that proficiency or that desire. So you guys did an excellent job. Let me ask if any of your classmates have any questions. Feel free to either unmute your microphone or type in the chat box. Is another way you can ask a question, if you have any.
I don't see the chat box, so I'll just ask my question. In the reading, we read a lot about personalities. Is there a difference in personalities?
Yeah. Well, I'll let the group answer that first, and then I'll throw in my.
Well, I'll just talk out of personal experience through different OBGYNs, for example. I felt like my OBGYN, my current OBGYN is a DO, the one that was, like I mentioned, was training my brother-in-law. And by the way, it was not weird to have my brother-in-law help deliver my baby. It just wasn't. So if usually people ask me like that, and I say, no, it was not weird. It was like, kid's got to learn his skills, right? But the personality, I feel like, I think there may be a correlation there of personality and wanting to do this whole holistic approach to medicine, at least at first, like Brother Wolf was saying, at least at first when they get into medical school and getting this training. Because the other OBGYNs that I had that were coincidentally MDs, they were very more, get in, get out sort of an approach, and more like Jake mentioned, like the cold, sterile, approach for medicine. This is your illness, or this is your problem, then I'm going to attack that, that problem per se. Whereas with my current OBGYN, Dr. England, he is just a completely different approach. It's all about my whole well-being. Just when we are seeing each other on the appointments or in the actual labor and delivery, he is there, and he seems to care about, my entire wellness, if that makes any sense. But
Okay.
I don't want to generalize it either. It's just my experience with OBGYNs, and I've had a few in the last few years, so basically that's what I saw.
Yeah, and I would agree. Again, you got to be careful of kind of stereotyping, but in general, that's probably true, because those that kind of have that attitude towards medicine will probably gravitate towards DO schools. But like I said, a lot of my friends that were in medical school had that kind of attitude as well. So it's not, it's not like anyone has a monopoly on that way of thinking. But in general, that's probably true. I think there's some differences there. But I would even say, to kind of take your question a little further, so in my first month or two of medical school, and I went to an allopathic medical school at the University of Illinois, it's kind of a joke to, in the first month or two, as you get to know your classmates, you already are picking out who are going to be the plastic surgeons, who are going to be the family doctors, who are going to be the psychiatrists, because a lot of that personality really does drive what specialty you go into. And it's kind of funny because you're trying to pick them out, and you know what? We were right more often than we were wrong. That you can kind of pick people out, even your own self, as people say, oh, you're going to be in this, and they're usually pretty right. So even within just allopathic or even within DO, I'm sure they have experiences too where they say, oh, you're going to end up being a trauma surgeon just because of your, or neurosurgeon because of your personality. And so I think there's a lot of truth to that. I work with a lot of attorneys. and they share similar experiences in law school. They say, oh, that person's going to be a litigator, that person's going to write contracts, and they kind of figure out based off of personality where people are going to end up. So, but in general, I agree that the DOs might be a little bit more laid back or a little bit more kind of systemically focused versus just this is your disease. But you know, you'll see a lot of that. Don't just assume that.
So are they more of a team player on a managerial side? Are you going to hit them on quicker?
I don't think so necessarily. And again, you'll see some DOs who are really strong-willed, and you'll see some MDs who are, you know, a little bit more laid back. But I don't think I've seen any general trends in that way.
It's funny because I know one of the nurses at the labor and delivery that works with my OBGYN, and she said that the way that he's with the patient is completely different than the way he's with the nurses. So I don't know, you know, it's hard to generalize it like you said, Brother Wolf, because, you know, people will be people, I guess.
That's right. And I think the reason we cover this topic in the course is mainly a lot of people don't know about osteopathic medicine. So we want to make sure people understand that if you're going to be an administrator or in healthcare management, that you know, look, they're not inferior. Their schooling is equal to, and in some cases maybe better. So you know, you want to make sure that you don't go into relationships in a hospital setting where you're treating the two types of doctors differently. They really are both competent. But beyond that, you probably just want to give everyone the benefit of the doubt and learn, you know, the unique traits of that individual. So.
Just more personality.
Yeah, exactly. So great question. Any other questions? All right. Well, your group did an excellent job. Thank you for all your hard work, and I will either later tonight or maybe early tomorrow post the link for the recording.
Okay.
Thank you.
Have a great night.
Thank you.